complaints against doctors will be processed more quickly and effectively under recommendations from a work group set up by the Health Ministry. Clearer legal guidelines will also give doctors an objective standard to refer to when dealing with patient consent. And for more on this story, we're joined by a member of the work group that came up with those recommendations. Dr. Tan Tze Lee is also president of the College of Family Physicians. Dr. Tan, thanks for coming in and speaking to us.
Thank you.
So this is sort of good for everybody on all sides, for doctors on one side and for patients as well.
Very much so. I think there is something for everyone. I think for the doctors, there is some clarity and a certainty about things going forward. And for the patients and the population in general, I think it bodes well, because we hope that it will actually improve doctor-patient relationships and really create partnerships between the doctor and the patient.
So do you think this will actually stop the development of, as we're hearing now, this defensive medicine that could actually push up health care costs?
Well, I certainly hope so. I think once there is certainty and there is less concern and fear, I think it can only lead to better things, and that is what we want to achieve.
Yeah, so we understand that there are fewer than 200 complaints against doctors a year, and out of these, a very small number actually make it to a disciplinary tribunal.
Yes, so, that's right.
Were these recommendations so necessary?
Well, I think if you look at the backlog has been huge, and the process has sometimes taken quite a long time. I think it's been quoted that's sometimes 6 to 8 years. So if we are able to improve that down to the recommendation of 18 months, that's a huge improvement. Divide by 4. So it's brilliant. Yeah.
So how are the recommendations going to work to help reduce this backlog then?
Well, the backlog will be actually taken care of by another unit. What we want to do is prevent or reduce the chances of another backlog starting by going forward. So once the mechanisms are in place, all the new cases will be under this new regime, which should give a better timeline.
Okay, so can you just talk us through maybe an example of how the new recommendations will impact or be something that patients can readily use?
The thing is, when they have a concern, they would make a complaint to the medical council, and that would go into this new process where there would be an inquiry committee, and that would be able to expedite things, going to the complaints committee, and then subsequently, should there be a need to escalate it up to a disciplinary tribunal, that would also shorten the time that is taken to do that. But of course, during the initial process, we would actually be looking at the veracity of the complaint, and if it is found to be without merit, that would be dismissed expeditiously.
So what are some of the biggest challenges faced by the work group, especially when coming up with these recommendations in terms of balancing the interests of the public on one hand and then the medical community as well on the other hand?
People always think that this is a dichotomy. I think it's a false dichotomy. Really, we are looking at patient safety and which is our main concern. And if we can look at that and provide an environment which is conducive for the doctor, the medical profession, to actually service the patient in their safety and their good care, I think we have achieved. So it is, I think those were one of the challenges we might have had, but actually it didn't turn out to be so.
Okay, and how are you expecting these recommendations to be rolled out?
We've put the recommendations to the Ministry of Health, and they have accepted it. And we look to be seeing things happening in the first half of next year.
Okay, so things are expected to start moving.
Oh yes, pretty fast.
Okay.
Yes. Yeah.
And did you a lot of when these recommendations, when you talk about the issues, it seems to me that communication between doctor and patient seems to be very high on or play a significant part in how we can mitigate miscommunications and things like that.
I think a lot of it is how we communicate with each other or don't. And the better we communicate with each other, there's less misunderstanding. And one of the things we're actually looking towards doing is actually improving on that. And one of the recommendations of the work group was actually to improve or increase the amount of mediation between patient and doctor. And I think we want to preserve, we want to improve the doctor-patient relationship, make it a partnership so they can get to their goal.
Okay, well, thank you so much, Dr. Tan, for coming in and sharing that with us.
Thank you very much.
Dr. Tan Tze Lee, member of the work group to review the taking of informed consent.